Hi guys, we're going to go over the osteology of the vertebral column, and then in relation to a process, a disarticulation and a laminectomy, which we're going to do on the cadaver, just so we can see the spinal cord and how the spinal cord runs within the vertebral foramina. So what we have is the vertebral cord runs in this canal that we can see here, which is formed by the transverse processes, the spinous processes, and then the laminae. And the different regions of the vertebral column, we have the cervical region, the thoracic region, the lumbar region, and the sacral region. Now the spinal cord actually only goes down to the level of L1, and then we see the conus medullaris, and then we'll see the horse's tail, the cordia equina, and then the filame terminal, the terminal filament, which we're going to see in the cadaver when we just go over to look at that. So what's important to remember, that when we start off by looking at the osteology, we have to remember that all of this is dressed by the anterior longitudinal ligament. And this is a really important ligament because it prevents hyperextension injuries. So in car accidents or RTCs, if you get a hyperflexion, hyperextension injury of the neck, the ligament can actually be damaged, and it's what's tethering all of the vertebrae and all of the IVDs in together. And what you'll remember from your earlier anatomy is we have some pretty important nerve roots coming out. We've got the brachial plexus, which is coming C5, 6, 7, 8, T1. Then we have the lumbosacral plexus, and then some sacral nerves as well, which we're going to look at. So just in relation to a little bit of pathology, which we're also going to look at in some of the cadavers in the next few videos, I just want you to think about kyphosis and lordosis, the natural curvatures of the spine, and something that happens over time with age as we get osteoporosis and the bones start to degenerate. We start to see the kyphosis, this kyphotic arching, and then what that can do is it can actually impinge upon the actual spinal cord itself, and we'll talk about that just once we've opened up the lamina and looked into the actual spinal cord within the vertebral column. So it's very, very important when you consider the underlying osteology, thinking about the spinous processes, which are very palpable points for you as future physicians or clinicians. These are points that you're going to look at when you examine your patient. You're going to be looking for symmetry of the back. You're going to be looking for any deviations, such as seen in scoliosis or lordosis, over-exaggerated lordosis, and some other musculoskeletal and osteological variations. So what we're going to do now is we're just going to perform a laminectomy. So we're going to cut through the lamina, which are just here on the on the sides of the spinous processes, and then we're going to just remove these spinous processes so that we can see the spinal cord within the vertebral canal.